Now we're injecting the foam slowly. As you see, it fills up the complex. And we accept foam into these reticulars knowing that they will clot some, but we'll get the clot out. But see, when we foam here, this is going to go down into the perforator. And although 0.12% foam doesn't seem like a lot, it's enough to do the job in these reticular veins. Actually, you can't tell the difference between 0.1, 0.3, or 0.2. So we'll give this time to clot up, and we'll show you in a little bit how we take care of it.